Hi, I'm Dr. Cate Crowley from Teachers College, Columbia University in New York City in the program of Communication Sciences and Disorders. And I'm here with my friends and colleagues in Guyana, South America, my speech therapist and also rehabilitation assistants. We're doing a cleft palate speech training here.
So hi, my name is Sonia Fredericks. I am a speech and language therapist, and I am based centrally in Georgetown, which is the main region in Guyana.
I am Tawia Lynch, a rehabilitation assistant from Fort Wellington Hospital, region number 5.
So, Tawia, could you tell us a little bit about what kind of speech services do you provide in your center and are available for people in general?
All type of communication disorders. We provide services for, be it aphasia, apraxia, swallowing, and cleft.
Mm-hmm. And tell me a little bit about the cleft services that you provide for there. Where do you get your patients? How do they get connected to you?
Patients are always being referred from the doctor. We have had patients that we've been seeing before surgery. Those were sent from the dentist or an ENT specialist, and after I've been working with them, they're being referred to see the
team.
Yeah.
And where is the team?
The team is at Georgetown Public Hospital.
There's only one team in
only one
the
team.
country.
Yeah.
Okay. And could you describe a little bit of the role of the speech language therapist and the rehab assistant when children come in with cleft palate speech? I don't understand what their role is. Let's say I didn't.
So we have speech personnel. We help people. We show them how to use what they have after surgery. Most times it's after the surgery. So
well, why doesn't the surgery just fix everything?
Not at all times. Sometimes it does. So the surgeon, so this is a surgeon here. The surgeon has done the surgery, repair the cleft, and send the patient home. The patient speaks the same way they used to speak before because they do not know to use the new apparatus that they have, the new
cleft,
really,
right? I mean, the new palate, let's put it that way.
Yeah. So you as a speech therapist, because I'm the child, you as a speech therapist come in and show the child how to use that new cleft, how to put all the
articulators, and so how to use all the articulators and just make the right placement so that you can just produce,
to help them to put each sound in the correct place.
Now, what do you mean by the correct place? For example, with the pa, what's the correct place? I don't understand.
The pa, the correct place is lip.
Okay.
And it's voiceless. And so we teach them that before they would say, and that's not the correct way. So we, as a speech therapist and a rehabilitation assistant, we show them, we teach them to put it into the right place. And to make it better.
Now, why do they, but tell me why, after they have the palate surgery, why doesn't the speech just get fixed? Why do we need any speech therapy after? Like, why were they making things like, 1, 2, 8, or
because they're accustomed to that, so they did not change the placement. That's where we come in.
I see.
That's where we are here to teach them how to use the correct placement. They are already accustomed to talk nasal, and most of their sounds is placed nasally. So when they speak, they will say my name. So everything comes as a which is not supposed to. Most times. Or yes, in the throat. So we teach them the correct placement. So for example, so we want pa, and they used to say So we teach them the placement to use the lip. Pa. But that it have to be constant. It cannot be in 1 week, 2 weeks, or 3 weeks. It got to be constant. You keep coming and repetitively, we're gonna get it.
Oh, great. Okay. And so I know you both were talking about the issue with using blowing candles, blowing balls across, sucking straws, blowing horns, strengthening the tongue, massaging the cheeks. I understand that was a practice that was here before.
That's what we were taught.
Yeah.
So that's the technique we're supposed to use when a patient come and cannot speak properly. It doesn't have to be cleft, but it does have any other communication disorder. The most important thing to do with that patient is just to do oral exercises.
Yeah. So that's what you were taught before.
Yes,
as a rehabilitation assistant. Of course, my being trained as a speech language therapist, we first brought across that change where we have been taught as speech language therapists that, of course, these exercises will not help your speech because of the different center within your brain where the two activities take part. So just letting the public know that, of course, the center of the brain that controls your speech is not the same center that does the movement. So therefore, when you're working on the movement, you're not working on speech. So you need to do speech, which is the output of speech sounds and language, so that your speech center can work and learn how to do it correctly. So I've learned that as a speech language therapist, we have came and we taught our assistants and everyone, and now to reinforce through our cleft palate training, we have learned more about it that this does not help our children at all.
I personally have learned more from the cleft palate training how important to use the technique of placement for each sound. So speech therapy, it's useless if you're not using sounds, right? It's some other kind. No, of course, I know. Well, I have to say there's still people in the US who use it, even with so much research. So it's a problem. It's much less of a problem in the US than it was before. But here in Guyana, what I love about Guyana is people hear the research, they hear the information, and they shift their practice. Also, people get to see how kids improve quickly when you're using the sounds, and nothing's happening when you're doing this. Sorry. And what I would like the people in the community to know,
please. Please.
It don't happen overnight, and need to be patient whilst doing the service, whilst doing the therapy. Especially caregivers and relatives, because we may go through one song maybe for 2 weeks before we have got the correct placement for that song. So it's a progressive something, step by step, until we get it. That's
a great advice for the parents. Any other advice for the parents or patients with repaired cleft palates, or professionals who see children with cleft palates who may not know the role of the speech therapist?
So definitely we would like persons to know that, of course, we think we do have a good system where we are capturing the children from birth. So from the time they're born, they have been delivered. So they're into the world. Our doctors, even our healthcare post workers and so on, they do know who to contact because the Cleft team have done a great job. But if you don't know, just in case, you can contact Georgetown Public Hospital, and it's Dr. Rajkumar who's in charge of the cleft palate team. You can contact us, no problem, speech language therapist, and we'll put you on to Dr. Rajkumar. So definitely, if a child has been born with a cleft, they need surgery. There's no question about that, whether it be a lip or a palate. So, but after surgery, sometimes before even surgery, some of these children may have feeding problems. So definitely we also, as speech language therapists, can help you mommies to teach you how to feed these children with special bottles and special techniques. So you can reach out to us. So after surgery, the main persons they need to see, that's the speech and language therapist, rehabilitation assistant. We're found in every single region in Guyana. You will not find the speech language therapist, but our lovely rehabilitation assistants are perfectly trained just as us to work with these children. So we need you. Take that time, bring your child for speech language therapy. we have now even developed that we can have session via Zoom. We can have via WhatsApp. You don't necessarily, you cannot afford to come to us. We come to you digital.
Yes.
So we're here and we're willing to help you in any way that we can. And of course, as my colleague said, it takes time. So it's not going to be one session, it's not going to be two, but just have the patience with us and we'll make your child better.
Yeah, because one of the reasons I love working with cleft, children born with cleft palate, is that you can actually make them go from having speech, it's really hard to understand, and they make to completely understandable speech that's the same kind of speech as we are speaking in right now. And Tawia, I know that you work in an area and know that area very well. Would you like to say anything especially to people who live outside of the Georgetown area, and maybe we'll also provide information on how to get in touch
One
with
thing
you.
I really want to get to them, remember the service is free. It's free of cost. It has no cost attached to it, no fees attached to it. And go to all the health posts and find out anything about Cleft. You will have that information.
Okay, great. And how would they get in contact with you in Guyana?
So the main location is at the Georgetown Public Hospital. I'm centered at the Georgetown Public Hospital. Our contact number there is 504-553-36. I'll just repeat that.
Do it again.
504-5536. You can call any day from Monday to Friday within the work period of 8 to 3 o'clock. And you just ask to speak to a speech therapist or a rehabilitation assistant, and you can book an appointment, and from there we take it. You come in, we do our assessment, and we can start. Of course, if you cannot come in, we make that arrangement to have a digital session. So in all of the regions, so that we cannot give you all the numbers for all of the regions, but if you call the Georgetown Hospital, the number I gave before, they will give you any number, name of person, and everything of where you can go within your region to access speech therapy. But in Fort Wellington Hospital, where my colleague is at Tawia could share their number.
One thing I want to say before I share the number is that some patients, especially some relatives for our area, may not understand speech. But if you could just come and say a child is talking properly, talking in the nose, they will direct you to speech department. If you don't understand what is speech, you just come and say, my child is talking good, and they'll direct you to where you have to go.
Right.
The number to get to our speech department in Region 5 is 232-0294. 232-0294. Next to the speech department or the department where you have to carry a child that's not talking properly.
Great. Well, thank you so much. I'm always learning so much from everybody here in Guyana, and I so much appreciate this. Thank you.
Thank you.
Thanks. Bye-bye.